Thank you. Good morning, everyone. I'm very honored and happy to be here. And when Dr. Peter and Dr. Enchi talk about the aging and HIV, I feel myself in the PPT. So actually, I was selected to verify their talks. First of all, I'm a smoker. And second, I have hypertension. And I have diabetes. Okay. And also, at the same time, you see my figure. I've been on DDG for 5-6 years. I'm gaining more than 10 kilos from that. And actually, I think I'm also a very old patient. My first regimen was called Crisevan, Indinavir. Most of you never heard of it, Indinavir. It's kind of PI, right? And you have to, I remember that I have to take exactly every 8 hours, 1 time, with empty stomach. So imagine, 24 hours, you have to take medicine 3 times, and every time must be awake and empty stomach. So it was very challenging, and AZT and 3TC. So I've been very, very long term come through. And so when we're talking about aging and HIV, people might, Dr. Peter and Dr. Enchi has talked a lot about medical biological perspective. So I would like to share about from the psychological mental health perspective. 2022 and 23, we have conduct integrated mental health and HIV operational research. We try to using the WHO recommended tools, and we hired involved professional specialists on psychiatric to conduct screening for over 772 people living with HIV who are on HIV treatment. And the funding is still in the process. But one thing we are sure that we found out that the elderly age PLHIV, the mental health condition, is much better than the younger people. And this is something just from the finding. And so actually we did some interview with some of these people, and it's totally matched from what we consider is, first of all, many young people, they have a concern, they have a burden on life expectancy. Even they heard that, yeah, they can live long, but they're still living in the shadow of the AIDS is a death penalty. And but for the elderly age people, they already pass through all these. Just like myself, when I started in Crisevan, and I pay was about $1,500 per month for them for the medication, and I didn't know how long I could last. And so I thought that maybe another 5 years. But now it's almost 25 years, which means I earned 20 years profit. So every day is a profit, right? Every day is a gift. So I feel much relief. And the second thing is about the people who are living with HIV, when they're getting into 50 above, according to doctor just mentioned about, like even the negative people, where more other units comes. And like I'm taking diabetes medication, hypertension medication every day, and sometimes I have to smoke too, right? So it's a pure burden. But after being taking Crisevan for 3 days, 3 times a day with empty stomach, so it's not a pure burden anymore. So I'm taking medication just like one of my meal every day. But for the young people, they always forgot. And And then on the other way, when we're talking back about the medical health, I think the biggest challenge in most of the country, in the developing country in the region, when we're having multiple disease, but people dare not to disclose their HIV status. They can't talk to the heart disease specialist about their status. They worry about being rejected from the services. So sometimes when they're getting a prescription from a specialist, but the specialist doesn't know they're also taking ARVs. So the medicine complication might happen. And also, there's one thing in our region, because we have to thanks for Global Fund accelerating the HIV treatment, enabling hundreds of millions of people get tens of millions of people access to treatment globally. But Global Fund also getting aged because they keep doing the same thing and ARV access, but we never try to thinking about how to integrating the services like multiple general medicine and specialist service with HIV service together. I think this is something is worth for us to try and explore that will greatly benefit for the people elderly in the elderly age, especially living with HIV. And also the stigma and discrimination, yes, we're talking about this for about 20 years or more. But I think anti-stigma and discrimination in the medical sector still an important task for some countries. From my experience, I think Thailand is very good on that. And but the other countries, I'm not sure, right? I can't tell. And so a lot of work needs to be done there. PEPFAR and Global Fund should really put in their limited resources. I know they are downscale the fund, but this money should spend on try to making the new model of HIV treatment and care instead of just focusing simply on ARV access. And lastly, I would like to say that as a PLHIV living for so many years, I celebrate, I'm quite happy every day, but also I think some of the psychology and mental health support and the multi-diversified medical services should be available for the community. And I think through this platform, I hope everyone can bring something back to your country, and then let's work with the big donors like PEPFAR and Global Fund to make this happen in the next few years. Thank you very much.